Welcome back. A patient in London has become the second person ever to be seemingly cured of HIV in the world. The news comes 12 years after the Berlin patient was also cleared of HIV. Announcing the news, scientists say the London case received a bone marrow transplant from a virus-resistant donor 3 years ago. 18 months after stopping his antiretrovirals, the virus is still not detectable.
About 37 million people are currently infected with HIV across the globe. The AIDS pandemic's killed around 35 million people since the 1980s. Now, a British HIV-positive man has become the second known adult in the world to be cleared of the AIDS virus. He's being called the London patient. Reuters' Kate Kelland has been following the story.
This man was living with HIV. He also developed Hodgkin's lymphoma, which is a type of blood cancer. He became very sick, and 3 years ago his doctors decided to try a last-ditch attempt to save his life, and they offered him a bone marrow transplant with stem cells from an HIV-resistant donor. So the donor's cells had a particular genetic mutation known as CCR5. This is a very rare mutation. It's usually only found in people of Northern European descent, but it is very rare, and it makes his cells resistant to the virus that causes AIDS. This is very significant. The International AIDS Society has described this as a critical moment in the search for a cure. The London patient is the second person ever worldwide to achieve remission from HIV on an extended basis, and it does mean that this is a proof of concept that a cure for AIDS can be found.
The first known case of a functional cure of HIV was in an American man, Timothy Brown. He became known as the Berlin patient when he underwent similar treatment in Germany in 2007. The London patient's doctors said this second case is extremely positive, but were quick to point out that it is not a cure for all.
This can't be done on a large scale. Bone marrow stem cell transplants are very complicated, they're very expensive, and they're very risky. In effect, they can kill you if they go wrong. So this isn't translatable to a wide population of people. What it does mean, though, is that scientists can explore this avenue, this genetic mutation, and focus on that as a potential cure in the future.
Scientific research has led to drug combinations that can keep the complex virus at bay in most patients. This latest triumph may not be the final solution, but medics hope they'll be able to use these findings to explore potential new treatment strategies.
And now joining us is Dr. Farid Abdullah, who is the CEO of the South African National AIDS Council and recently appointed head of the Office of AIDS and TB Research at the Medical Research Council. He joins us via Skype. A very good evening to you, Doctor. Thank you so much for joining us. First of all, can you categorically state on record that a cure for AIDS has indeed been found and this is a time to celebrate?
Well, this is certainly a cure. The second case of a cure using a bone marrow transplant, and it's without doubt a cure, but this is not the cure that we're looking for. This is a cure in very rare situations with a very risky and complicated treatment in patients who have leukemia or lymphoma, which need this kind of treatment. But certainly, if this is possible, and it's now been possible a second time around, then it gives scientists a lead in to find other ways to generate this genetic mutation in people who are living with HIV. And that means that this is a proof of concept, as your briefing said, for further research into finding a cure for AIDS.
Doctor, do you want to simplify issues for us if you can? When you say that this is not the cure that you're looking for, what exactly do you mean? I mean, the reasonable expectation is that there's only one cure for AIDS.
Well, in this case, the cure for these two patients required a bone marrow transplant. That means that the individual's bone marrow had to be wiped out with very strong chemo and radiotherapy and replaced with a donor's with the donor's cells, stem cells, which then regrow in the patient's body and bloodstream. That's a very complicated procedure. It's risky, it's dangerous, it's expensive, and it can't be used to treat the millions of people who need treatment. What we need is to find a medicine or something else which changes the genetic makeup and generates this mutation, this cell which is resistant to HIV inside a person's body. So it's important to know that if we can do that, then we have two examples of patients who have been cured, and that trying to make these changes will result in a cure. But this is not the cure.
What's the difference then between the latest case and the Berlin patient case? Does that mean that the bone marrow transplantation is generic, or it's specific to a certain blood type?
Well, bone marrow transplants are reserved for people who have cancer of the blood. So both these patients had HIV, but they also had cancer of the blood, which is a leukemia in the case of the first patient, and a lymphoma in the case of the London patient. It's only in this setting that you can consider a bone marrow transplant. If a patient who has HIV, and as you know, we have about 8 million people in South Africa living with HIV, we cannot provide these kinds of bone marrow transplants for all 8 million patients because it's too risky, it's too expensive, and it's too difficult to do.
And I suppose,
if we find another way to create this mutation where the cells cannot be infected by HIV, then this would be a way to discover a cure for HIV.
And I suppose, it's very important that we should re-emphasize the importance that people should continue protecting themselves, isn't it?
Yes, so these two patients reflect important advances in science, and we can study them, the scientists are studying them, and it will help to find a cure. But for now, what we have is antiretroviral treatment, and our patients who are on treatment in South Africa and throughout the world need to know that for now this is the most effective treatment. They need to take their pills every day and continue with their treatment, and they will be able to live normal, happy, and healthy lives.
Now, Doctor, the London patient has been in HIV remission without ART for the past 19 months now after the bone marrow transplant. Is 19 months a sufficient period to make a determination that indeed a cure has been found? Or is it too early?
Well, I think some of the scientists are still calling it remission. But in my own humble opinion, I think that we can safely say that this patient, like the Berlin patient, has been cured of HIV.
This then gives researchers a new insight into the whole technology surrounding bone marrow transplantation. Does this not offer a new window for scientists, to look into to find alternative cures for AIDS?
Yes, so one way to do it was if we could, if the scientists could find a way to alter the genes through something called gene therapy, then they wouldn't have to replace somebody's bone marrow or blood cells, but they'd be able to change, to genetically modify, if you want, the cells that you already have, and thereby make them resistant. So that would be sort of the most obvious line of scientific research to follow. But the idea of a bone marrow transplant for everybody living with HIV is not really something that we think is possible.
I understand that in some tissues, the antiretrovirals may not penetrate well. Under what circumstances does this happen?
So this is the problem with antiretroviral treatment. Antiretroviral treatment, if taken as it should be every day, usually within 4 to 6 months, it clears the bloodstream of the HIV virus. But the virus hides in reservoirs throughout the body, in the gut, in the organs, the abdominal organs, and other parts of the body. When somebody stops taking antiretrovirals, then the virus re-emerges from its hiding places, from these reservoirs, as we call them. And that is why antiretroviral therapy is not a cure. It only controls the replication of the virus. And to control HIV, someone has to take those antiretrovirals for the rest of their life. That's why we want to find a cure, because it would be so much better if we had a treatment which lasted a few months or a few weeks, which cured, which removed the virus from all these reservoirs in the bloodstream and in the organs, and destroyed it once and for all. That's the ultimate goal of finding a cure. But the bone marrow transplant is not yet there. There are a number of other lines of scientific research being followed, and there's a lot of optimism about them. But the important thing to know about the London patient is that it does offer so much information about how a cure could be possible.
Will the same technology or methodology apply perhaps in the mother-to-child transfusion?
You know, in the case of mother-to-child transmission, antiretroviral treatment it prevents the transmission from mother to child, and children are born HIV-free. In a way, you could say that's curing the child. It's not a cure because the child has never been infected, but it prevents infection in the child. But this kind of bone marrow transplant would not be an appropriate intervention in pregnancy. The antiretroviral drugs do a pretty good job. These days, we also recommend antiretroviral treatment to the mother during breastfeeding so that it reduces the risk of transmission to the child. We already have a very effective way of preventing HIV in children, but a bone marrow transplant wouldn't be appropriate in this instance.
All right, Dr. Abdullah, thank you so much for your time. That was Dr. Farid Abdullah, who is the CEO of the South African National AIDS Council and the recently appointed head of the Office of AIDS and TB Research at the Medical Research Council.